Hello, and welcome to Greenwood Wellness Clinic, where we are committed to providing quality medical care and education in our community. Hola y bienvenido a Greenwood Wellness Clinic, donde estamos comprometidos a darle cualidad, atención médica y educación en nuestra comunidad. All of us here at North Tulsa's first medical practice performing medical marijuana assessments are excited to help you find relief from chronic pain and ailments. We take the worry out of alternative medicine and the process to obtain your legal medical marijuana license.
Hello, I'm Marvin Jones. Our doctors and team of trusted professionals have decades of combined experience in serving people in the North Tulsa community. Many have roots in this community and proudly call North Tulsa their home. We take pride in serving our community. That's why we aim to make sure you feel welcome and as comfortable as possible, providing the very best patient-focused customer service. During your visit to Greenwood Wellness Clinic, our doctors will assess if medical marijuana treatment may be beneficial to you or your loved one's existing medical condition.
Hello, my name is Dr. Darnell Blackman. As we know, education is a big part of our process. Our team at Greenwood Wellness Clinic seeks to provide you with a strong knowledge base on medical cannabis. Most people know cannabis by the slang term of weed, pot, green, herb, etc. Because medical marijuana is the most common nickname, we'll use this in our video. Studies have shown that medical marijuana may be a safe and effective alternative to many expensive, ineffective, and highly addictive prescription medicines such as opioids. There are hundreds of medical uses for marijuana. The most common ailments that medical marijuana has shown to benefit include arthritis, cancer, chronic pain, Crohn's disease, epileptic seizures, fibromyalgia, glaucoma, HIV and AIDS, multiple sclerosis, and severe nausea, just to name a few. You can find a more complete list on our website at greenwoodwellnessclinic.com. So what are the differences between medical marijuana and recreational marijuana? The cannabis plant, as we know, contains over 100 chemicals. Of those, tetrahydrocannabinol, or THC, is the psychoactive component that produces the euphoric or high experience. Cannabinol, or CBD, is the compound used for medicinal purposes. Medical marijuana has a greater CBD component, so you receive the medicinal benefits without the euphoria or high received from recreational marijuana. To be clear, CBD is 0.3% of THC. In some cases, there's zero THC. So, is medical marijuana a new drug? As it turns out, marijuana has been used for thousands of years for the treatment of medical ailments. Historical data indicates the use of cannabis or marijuana by Chinese far back as 2700 BC. Emperor Shennong was a pharmacist who tested the medicinal purposes of hundreds of plants on himself. He wrote a book citing cannabis for the treatment of rheumatism, absent-mindedness, gout, and constipation. The ancient Greeks used cannabis to treat inflammation, ear pain, and to dress the wounds on their horses. Ancient Egyptians used cannabis for the treatment of tumors caused by cancer. Medicinal cannabis has been used in India for centuries. Cannabis made its way to North America and was listed as an acceptable medical product for almost 100 years, from 1851 to 1941. The term marijuana came to the United States from Mexico in the early 20th century. Since the late 1930s, medical cannabis has been lumped into the same category as recreational marijuana, and a stigma against marijuana formed. Medical cannabis, or medical marijuana, which is free of the psychoactive compound, has been used for centuries to treat chronic pain and to bring relief for many illnesses. Greenwood Wellness Clinic promotes the use of medical marijuana for the health and wellness of our patients. So what is the difference anyway between chronic and acute pain? Chronic pain is described as lasting more than 3 months, while acute pain is one which you would experience from an ankle sprain or a fracture. Next, we must also discuss the dangers of highly prescribed opioids. Opium, which is derived from the poppy plant, has been used for the treatment of pain and other ailments as far back as 3400 BC. Opioids, while beneficial in treating chronic and acute pain, can be very addicting. Painscale.com reported that in 2014 alone, a record high of almost 30,000 people died from an opioid overdose. In 2017, 16,500 patients died from opioid overdoses in the state of Oklahoma alone. It is this concern for addiction and abuse potential that has resulted in the medical community looking to alternative methods of pain management. Many doctors and patients have turned to medical cannabis as a safer, less addictive method for treating chronic pain. But is cannabis just as good as opioids at pain management? Well, according to a comprehensive Harvard study in which more than 10 other research studies were reviewed, the use of marijuana for treating chronic and neuropathic pain was supported by data-driven evidence. 6 out of 6 studies focusing on chronic pain and 5 out of 5 studies on neuropathic pain proved that using cannabis significantly alleviated chronic pain symptoms. Currently, pain management clinics are also weaning patients off of opioids with the use of medical marijuana and CBD. Here at Greenwood Wellness Clinic, we are committed to helping our patients receive the most effective treatment for chronic pain and illnesses.
And now, the law. Medical marijuana use is legal in many states. In 2018, Oklahoma passed a law permitting medical marijuana to be grown, processed, and dispensed under set guidelines. To legally obtain your state-issued medical marijuana card, a recommendation from a qualified physician is required in Oklahoma. At Greenwood Wellness Clinic, we encourage you to bring your medical records, prescription bottles to your appointment. This will help our doctors to better assess your eligibility for medical marijuana use. Our medical doctors abide by strict guidelines when evaluating your medical need. There is a chance our doctors may refuse to write a recommendation, believing you would benefit more from other treatments. Our doctors will confirm that there is a real and legitimate medical health reason why medical marijuana is an appropriate medical treatment option for you. They are not approving you to use recreational marijuana. Again, it is medical marijuana use.
Greenwood Wellness Clinic is your first step in the process to obtain your legal medical marijuana card. Rest assured that you are in safe, confidential, HIPAA-compliant environment. We care about you. What you need today, your driver's license or a government-issued photo ID such as a passport or identification card. A visit without your medical records could make your visit a little longer and may require more than one visit. Why? Our doctor needs as much information as possible regarding your medical history to make the best decision for your possible medical marijuana card recommendation. However, a medical record is not required to obtain your medical marijuana card. What you can expect. Shortly after the end of this video, you will be taken to an examination room to be seen by a member of our clinical team. One of our doctors will take your vital signs, review your medical history, and complete your evaluation. You may be asked to provide a urine sample. If you receive doctor's approval, we will take your photo. A passport-sized photo is required when applying for your legal medical marijuana card. Please do not smile during your photo. No hats, head covering, or eyewear is permitted. The state will reject your photo otherwise. Our team will then help you submit the necessary forms online to the state of Oklahoma. The state charges $100 via credit card or debit card. With Medicare or Medicaid, this reduces the fee to $20. This will complete the first step in the medical marijuana application process.
The fees. The cost for today's visit to Greenwood Wellness Clinic is not covered by your insurance. We do offer discounts for veterans and cancer patients, and we accept cash, credit, and debit cards for your convenience. Next steps. Once you receive your medical marijuana card, what happens next? Your medical marijuana card protects you in Oklahoma. You may possess up to 3 ounces of marijuana on your person, 8 ounces of marijuana at your residence, up to 6 mature marijuana plants, 6 seedling plants, 1 ounce of concentrated marijuana, and 72 ounces of edibles. Greenwood Wellness Clinic is not a medical marijuana dispensary. We do not have any marijuana on site. You may purchase CBD products on site, or our team can provide you a list of locations where you can obtain legal medical marijuana.
Thank you for choosing Greenwood Wellness Clinic for your medical marijuana assessment needs.
Nuestro grupo estamos felices en servirle. Por favor, no se preocupe si tienes preguntas. Gracias en escoger Greenwood Wellness Clinic para tu médico de marihuana evaluación.
We here at Greenwood Wellness Clinic look forward to serving you. If you should have any questions, please do not hesitate to contact our staff. Thank you.